For 20 years, World Vision has partnered with communities, governments, donors and supporters to improve the well-being of children. Together with you, our partners, World Vision has journeyed with children from sorrow to joy, sickness to health, hunger to plenty, despair to hope, darkness to light. When we started in 1994, we were driven by the urgent and immediate need to provide short-term relief, food, shelter, medicine and clothing to children and their families who had suffered the brunt of the genocide.
There were 100,000 children estimated to be separated from their families when we went in. So we had a lot of children who were in these care centres initially.
Genocide had many effects in the lives of Rwandans, not only in the area of shelter, but in many aspects of their lives. The social fabric was completely destroyed. So World Vision played a very key role in rebuilding the nation. It was with time that we discovered that without the peace of heart, without the true trust between the community, without the real cohesion, harmony within the community, nothing works. Actually, it was very easy for World Vision to integrate peace building with Christian commitment, promoting peace building with biblical perspectives of Christianity and faith.
6 years later, it was apparent that long-term programming was the solution to confront development challenges of poverty, hunger, disease, discrimination, abuse, and ignorance that children had to endure daily. Currently, World Vision is active in 15 districts across the country. World Vision has constructed and equipped 9 modern health centers and 19 health posts, which has brought health services closer to children, expectant mothers, and communities. Through health and nutrition programs, 25,000 severely malnourished children and over 34,000 children with special needs have received treatment. Uwinyingi, an ultra-modern health center in the southern province of Rwanda, now provides medical services to over 25,000 patients every 3 months.
Before the health center was brought closer to us, we used to walk for 2 hours to Ikitabi Health Center. It was very difficult for us, but things have changed today. The health center is closer. Pregnant mothers who previously found it difficult to get to the health center can now get there in less than 30 minutes.
In partnership with the government of Rwanda, World Vision has drilled boreholes across the country that have saved children and mothers from traveling long distances to fetch water, constructed 208 water springs, 208.7-kilometer water pipelines. In a bid to improve hygiene and sanitation, World Vision also constructed 1,475 school latrines. Under economic development, World Vision has provided cows and 93,838 other livestock, including goats, pigs, rabbits, chicken, and has helped 3,274 vulnerable households with biogas stove.
Furaha.
Nearly 30,000 members of the Village Saving and Lending Association have also been able to save 213,685,750 Rwandan francs since 2000. Targeted households have been supported to grow sufficient quality food all year round and to have surplus to sell, thus improving household income. Youth have also been facilitated with skills leading to positive behavior change and economic independence. Children have access to basic education that will help them become productive members of their communities. World Vision has also integrated ICT in education. World Vision has constructed 1,048 school classrooms, provided 8,488 solar lights to public schools, and over 15,000 desks to various schools. Our supporters, well-wishers, partners have selflessly worked with us to overcome some hurdles.
If you see how we cooperate with the World Vision, we work together as one team, we plan together, they come to ask us which are the priorities of the people in order to plan in resolving problems of the people. So they are the best.
20 years on, many more children are enrolling and keeping in school. The number of children enjoying good health has increased. Children are protected, cared for, and participating as they experience the love of God and neighbor. It is a gratifying journey of transformation.
As we go into the future, one key piece that is going to be a key peg of our programming is a market-led agriculture, which is one of the key pillars of Vision 2020 and EDPRS2. We are working very closely with our farmers, forming them into what we call village savings and loans groups. And these village savings and loans groups graduate into what we call producer groups. And these producer groups eventually become commercial villages. A commercial village is an entity that is very connected to the market. It is able to grow high value cash crops that they can be able to leverage for their incomes. Once their incomes increase, then they can be able to take care of their needs at home, health insurance, education for their children, and generally ensuring that their family is well off. We are looking at fullness of life, not just for children, but for their families and their communities. That is what World Vision Rwanda is going to focus on, supporting our government so that indeed the dream of Rwanda being a middle-income country by year 2020 could even be realized sooner.